Study suggests the subvariant of Omicron BA.2 causes more severe disease in unvaccinated children than previous strains of COVID-19.
So here to answer some questions is Dr. Sandra Nelson, an associate director within the Division of Infectious Diseases at Massachusetts General Hospital. Dr. Nelson, thanks for your time.
Thanks for having me.
So, Dr. Nelson, we don't need to tell you, as you know, there's no vaccine available yet for kids under 5. So specifically, what do those parents need to know about this new research?
So I think the first lesson is that it's really not yet time to sound the alarm. I think we've seen that this virus behaves differently in different populations with different levels of host immunity. And really what we've seen in Hong Kong is different than what's been seen in other places where BA.2, the subvariant of Omicron, has been prevalent than what has been seen elsewhere. And really what we know from the United States with our own Omicron wave is that even though it really did differentially lead to more infections in children, it really was not more severe. And that data is pretty conclusive. So I think we really just need to see how this evolves. But right now, I'm not unduly alarmed.
Are there any theories, Dr. Nelson, why BA.2 might affect children differently than it does adults?
So I think just to clarify, BA.2 is one of the subvariants of Omicron. In the United States, while we are seeing more BA.2 now, our major Omicron surge was a BA.1 surge. And we actually don't think there's a lot of difference between this BA.1 and BA.2 in terms of their likelihood of causing severe disease. At least in places where they've had both BA.2 and BA.1, they seem to be similar. So really our experience is around Omicron in general. And what we do understand about Omicron is that this particular variant seems to affect the upper airway passages and the nasal passages more than the older variants. That's one of the reasons it's more mild in adults, because they're just not getting the lower airway disease or the pneumonia that we saw with the other variants like the Delta variant. But for children, when you have disease involving the upper airways, those passages are smaller. And so children can have more complications. We've seen more croup, for example, which is an inflammation of the upper airways with the Omicron variant than we've seen with other variants in children because of this upper airway predilection.
Interesting. Okay, first time I've heard that. So we did learn this today, which sounds like good news. There are fewer people hospitalized for COVID right now than in any other point during the pandemic. Is that true too at MGH?
Yes, it is true at MGH, and it's really been reassuring. We've had right now we've got a little at over 20 patients in the hospital with COVID. And this has been pretty steady. So for the last 4 to 5 weeks, that number has wavered just a little bit, but in that general range. And that's a pretty comfortable range for us. And that compares with levels of a hospital census of over 200 COVID patients earlier this year in January when we had the peak of the Omicron wave. And the other piece about this is that not all of those 20 individuals are hospitalized because of COVID. Because Omicron is milder, we are seeing more people hospitalized with the infection rather than for it. So we're not right now seeing a huge burden of infection due to COVID.
Well, now that we know that BA.2 is the dominant strain here, let's hope that those hospitalization numbers stay low and we don't get a surge like we had back in January. Dr. Nelson, thanks for your time.
Thank you.